Now it's time for today's perspective, and sexual violence has become a hallmark of conflict in Sudan. It's the depressing start of a new report from MSF as we approach, in a few weeks' time, the 4th anniversary of the huge war in the country. The report says the scale of devastation inflicted on civilians in Darfur is difficult to comprehend amid an even longer history, of course, of repeated cycles of violence and atrocity. The report saying that in 2024 and 2025 alone, nearly 3,400 survivors of sexual violence sought care at MSF healthcare facilities across the north and south of Darfur. 97% of them were women and girls. We're joining us is Deputy Emergency Operation Manager for Sudan, Amande Bazerolle. Thanks very much for joining us on the programme. In that figure of 3,400, I mean, obviously it's just a drop in the ocean for the real number of women and girls who were actually affected.
Exactly. There is a lot of impediment that allow the women to be able to reach and to seek for care. The problem is definitely the lack of funding, but the lack of access as well. So we are just representing here what MSF is able to do, and that's very limited considering the wide scale of the atrocity that are perpetrated in Darfur, but not in Darfur itself. It's just that Darfur, that's where we have the most of our activities, but we know that it's across the country itself that we have seen those atrocities.
It comes, of course, amid a terrible war there, and many of those attacks saying they were attacked by someone who was armed.
Absolutely. It happens very often at the time when there's an escalation of the fight, or the people are trying to flee. And we saw that, especially in northern Darfur, with the attack on Zazam camp in 2025 and the besiege of El Fasher and the fall of El Fasher at the end of the year, when we have received a lot of women in our facilities, the one who managed to escape the terrifying siege of El Fasher.
And nearly 60% of those attacks say they were actually attacked by more than one man as well. Exactly.
The ordeals are absolutely horrific, but the scale of it and the fact that it's happened repeatedly, the fact that it seems even inevitable for the women when they're trying to find safety somewhere, when they have to flee, and sometimes even in just a daily task when they need to seek for food or fetch from wood to be able to cook for their families. And indeed, the perpetrators, as you said, is vastly majority are armed groups, and very often in Darfur itself identified as the rapid forces or their allied that are also targeting ethnically the women. So we're talking about the Fur, the Masalit, and the Zagawa population that has been targeted for many, many years and still are targeting during that war in Darfur today.
I mentioned that figure at the top, the 97% of those who you help and try to cope with are women, but there are some men as well. It's a much, much smaller problem, of course.
There's a lot of stigma. There's a lot of reasons of the people who are not able to reach out to seek for care and for mental health support, and the stigma is already very huge on the woman, but on the men it's even more. So we have seen some terrific wounds, and it's often only because through the medical care that they can reach us, more than just to find some support and prevention for the sexual disease that they are also in front of them because of the magnitude of the rape that are happening today.
So presumably there are some men who or even more men than women perhaps, who don't want to come forward.
Absolutely, it's impossible for us to have a real overview of the number of people. We just know that when we are doing some community-based activities, there are much more people who are reporting having been abused than the one that actually come to the clinic to seek for health care. sometimes because they feel it's too late, sometimes because they fear of retaliation, and sometimes just because they don't have the means just to be able to reach the clinic. The lack of funding means that MSF is here, and unfortunately, we can still deliver some care, but we cannot reach out for all the population. And a lot of organizations are really struggling today because of the lack of funds to be able to provide care. And we're talking about sexual health and reproduction, but we're talking about all the different aspects of humanitarian aid in the country today that is underfunded today, considering the magnitude of the health crisis and the crisis in Sudan. We're talking about 9 million people that are displaced in country, and altogether 14 with crisis that is spreading out to other countries, namely in Chad and in South Sudan, in Egypt, where there's a lot of displaced people as well coming from Sudan.
So tell us what you are able to do with the funding that you do have.
So usually it's very important for them to try to come very early on to be able at least to prevent any sexual disease, and that's but it's very often that they come very late because it's not their priority. Those people are lacking absolutely everything. Like the priority is to be able to eat and to feed your family, and already that is a struggle. Like among the pregnant women, we still see, even in Tawila, where we are working, where we have access and relative security, the women are still very malnourished. The pregnant women is still more than 30% of them that we are treating that are malnourished. So unfortunately, they don't really know about the prevention that we can provide, and again, it's not their priority. The priority is really survival. So it becomes a secondary priority for them. So what we are providing is the prevention of drugs to avoid any kind of sexual transmittable disease, the hepatitis B as well, and some we are trying, but we are struggling because we are limited with the number of people that we can bring in Sudan and the availability of population. So the psychological care is very underfunded at the moment, and even us, MSF, we are struggling to be able to implement. We will start only now after more than 1 year of activities in Tawila.
And you mentioned security, and presumably that's a major issue for you as well, because you can only operate with the resources that you have, but you also have to ensure that your staff are secure and able to operate freely.
Exactly, and but there's also administrative issues. So there's a lot of them. So we're ready to take some risk, and we have done it in many other countries, and we are here since the beginning of the war. We have been here in El Fasher, in Zamzam. So we are ready to take some risk to support the population, and we're following that population. But it's mainly our colleagues, our Sudanese colleagues, who are taking risk as well, because they're the same people. They're the people who have to flee the conflict, and now they're the ones who are caring for others. So it's very complicated. And in Darfur itself, at least we have some access, but in the east part, it's much more difficult for us to implement some sexual violence programs because of administrative impediments that are applied by the Sudanese government. So we have underreported numbers for the eastern part compared to Darfur, because in Darfur at least we can provide some sexual violence programs.
Good to have you with us on the programme today. Thanks very much for talking to us. Amande Bazerolle, Deputy Emergency Operation Manager for Sudan from MSF. Thanks.